This video will cover cold autoagglutinins, which can cause immune hemolytic disorders and ultimately red blood cell disease. To anchor ourselves, we'll use the snowy cold weather and the IgM molecule. That huge I represents anti-big I, the IgM antibody that mediates this disease. And even though this I is big, it's not as scary. It doesn't look like it's going to hurt us. The fact that it likely won't hurt us reminds us that anti-big I is usually non-pathogenic. Take a look at that massive statue. It reminds me of a titan. This tall titan I feel like could definitely hurt us, and it represents the fact that high titers and broad thermal amplitude are strong predictors of pathogenicity for anti-big I. So this titan represents that by being tall, just like high titers, and broad, just like the broad thermal amplitude. The green check mark and compliant wording remind us that IgM can activate complement. There are two types of disease associated with cold agglutinins. Let's look at the first one by starting with Grandpa here. He represents the first type of disease, which is idiopathic cold autoimmune hemolytic anemia, also known as cold agglutinin syndrome. This tends to happen in older individuals and presents with Raynaud phenomenon and intravascular hemolysis. Altogether, the old man represents older individuals, his mittens represent Raynaud phenomenon, and the bottle of red liquid not spilling represents intravascular hemolysis. The second type of disease associated with cold agglutinins is called secondary cold autoimmune hemolytic anemia. It is a transient condition caused by anti-big I when associated with Mycoplasma pneumoniae and by anti-little I when associated with EBV. Since childhood is a transitional phase in life, that will help us remember that this condition is transient. The kid coughing next to the big I will remind us that anti-big I is associated with Mycoplasma pneumoniae infections. The other kid holding a protein bar named EBV will remind us of EBV-associated infectious mononucleosis.